Endo Pharmaceuticals are the ones who have provided the money for me to be here, to provide you with the food and all of the workbook. It was an educational grant for us to come out and talk with you. So I want to thank them. And I also want to thank every one of you, because without you, our country wouldn't be what it is today. And I really appreciate the service that you have given to our country. It does not go unnoticed. And there's a lot of people that are very supportive of your efforts. And every time I tell someone about the program that I'm doing, they say it's about time. So again, I want to thank you, and it is my honor to be here with all of you. So thank you all very much. So what is the American Chronic Pain Association? We've been around since 1980 to provide help and hope for people with pain. What we are not, we're not healthcare providers, so we don't provide any kind of medical treatment or advice. But we have groups all over the world for people with pain. And while we can't cure your pain and we can't provide you with any medical treatment, we can provide you with ways to improve the quality of your life. And we're going to talk about a lot of that today. Our mission, and we have started this mission back in 1980 and we have never strayed from it, is to provide peer support and hope for both people with pain and their families. And I'm delighted that some spouses are here today with you, but also to raise public awareness around pain. You don't hear a lot of anywhere in any of the media about pain and the issues that people have to deal with pain. And that's something we really want to begin to change. So we've done a number of things to try to bring pain to the forefront. Really, what American Chronic Pain Association is just people helping people. And when I started this back in 1980, my goal was to reach out to one other person. And that is still the mission of today. It's not about massive numbers, it's about one person, because each person is very important. Because that person has to live with pain on a day-to-day basis. So that's why we're here, is because of one person, not groups. Delighted to have you all here. We also have a website, and I know that the gal who manages this and developed it is going to be here, at least she was planning to be here, and it's called vetsinpain.org. And that's going to be a direct link from our webpage. You can go to vetsinpain.org now, and there's a lot of really good information for veterans, a lot of resources, things that I really don't know anything about. So she has volunteered her time to do this. So this is a website specifically for veterans in pain. So what is chronic pain? You know, it's the number one cause of disability in the country. But you know, what's really interesting is that there's 116 million people who are living with chronic pain. Now that's about 1 out of every 3 people in this country. Think about it. How often do you hear about it? Very rarely. And yet it's 1 out of 3 people in this country are living with some form of pain. The Institute of Medicine just came out with their new report. And so now this number right there, 116 million, that is an accurate number. That is a huge number of people who are trying to live day to day with their pain. The cost? And we used to say it was almost 300 billion. Well, the Institute of Medicine just came out with a new cost. Between $500 and $600 billion a year. That's more than cancer, heart disease, and diabetes put together. That is how much pain costs in America, only in America. And trust me, it is all over the world. There's another part of pain that people, and a cost to it. People who still have jobs, that still go to work, but they don't perform up to where they should be working because they need those benefits. It's called presenteeism, where they're at work, but they're not really performing their job to the fullest of their ability because they're in pain. And so their coworkers have to work with them. They have to take up the slack. And that's a huge expense to this country. It's over $61 billion. And again, all of this information is on your handouts, on your slides. So what is chronic pain? It's a process that turns a person into a patient. And what the American Chronic Pain Association wants to do is to change that idea of a patient back to a person. And I must tell you right now, and you'll hear me referring to people with pain, because I really hate the word chronic pain patient. It's a negative phrase, and it sort of just takes away, it takes like the air out of you. It sort of just deflates you. So you're a person with pain and so much more, but your pain does not identify who you are. It's only a piece of you. So what we really are trying to do, and you'll see everything that we have, is moving from that patient back to a person again. And that's really the focus of what we're really trying to do here today. What is chronic pain? It's any pain that lasts longer than 3 months or goes on beyond the normal healing process of an injury or an illness. It will affect your life. I mean, it really puts a damper on what you can do from day to day to day. But the hardest thing about pain is that second bullet point. It's never consistent. It's never 100%. It's never at a 10. It's never at an 8, constantly day in and day out. Your pain goes up and then it goes down. And you do have good days. And then it goes back up again. And so because it's going up and down and up and down, it's really confusing. Because you often wonder, is it really pain? Maybe I am imagining this. And I know I have gotten a lot of calls in our national office from people who say, my doctor told me it's all in my head. Well, it is partly in your head and it's in your body. You can't separate your mind and your body. You are a package deal. And what you're going to experience in your head, you're also going to experience in your mind, in your body as well. So it's the whole person. You're not imagining it. But the hardest thing is that inconsistent up and down. And then people around you look at you and go, well, how can you do that today when yesterday you couldn't get out of bed? Or, look what you did yesterday and now you can't move. It's just confusing, not only to you, but to everyone around you. And you question it. I know I did. And just to let you know, I'm also a person with pain. That's why I started this organization. And I went through a multidisciplinary pain management program. It's been 32 years now. And that was the hardest thing I ever did in my life. Because when I went into that program, I was a patient in every sense of the word. And holding a cup of coffee for me was almost impossible. That's how bad my pain was. And I spent 7 weeks on that program. And I actually, when I went there, I didn't believe anyone could help me. I went there to fail, to prove to my husband that there was no help. After 6 years of looking, hoping for an answer, one thing after another, hopeful that it would help, and then it never really helped, and the pain was still there, and I kept getting worse and worse. He believed that this would help. That's what he believed. So I thought, all right, because I just wanted to quit. I just wanted to give up. I had enough. It's hard to live with pain every day, in and out and in and out. So I went. 7 weeks later, I came out, in every sense of the word, a person. So everything that I'm talking about today, I've been there, I've lived it, I know exactly what it's like to live with pain on a day-to-day, and I know the controls it has on your life, and we will talk about that. But for me, the hardest thing was, if I could just get a healthcare provider to understand my pain, to know how much it hurts, if I could just describe it in the right words, then they would get it. Because it's impossible for people to understand your pain. How do you explain it? So I would spend hours on end trying to figure out the best way to describe my pain. You know what the problem was? The more I thought about my pain, the more I suffered. So I was really not doing myself a favor, because I kept increasing my sense of suffering because I was trying to figure out how to describe my pain. And you can't do that. No one is ever, ever, ever going to understand what your pain feels like. No one. We expect miracles, right? Imagine what people can do today, what medicine can do. They can do a number of different organ transplants, hearts, lungs, livers. That's amazing. That's absolutely amazing. They just started, and I think it was the 3rd or 4th successful face transplant. So it doesn't make sense to us that they can't fix our pain. It's not logical, right? Our expectation is, just give me the right pill or that one procedure, that one surgery, and I'll be good, right? Never works. And what happens is you get stuck in that little maze. And you just go from one dead end to another, and you're just sort of stuck in there. And the harder you try to find the one answer, the deeper you go, and the more you get stuck, and the more hopeless you feel. That's what it's like when you have chronic pain, and you're hopeful. I mean, our expectation is medicine can eliminate it, right? Doesn't that make sense? And it's not that easy. Why? Because pain's invisible. What does a back pain look like? What does a headache look like? How can you see someone's nerves that feel like they're on fire? You can't. It's invisible. You can't measure it. You can't weigh it. There's absolutely no way to say, aha, I see it. I mean, you're all people sitting there with pain, and yet they look fairly normal to me. Who would know? So it's really hard. It is really hard. And I kept saying, if only they knew what was causing my pain, I'd be able to manage it. Problem is, once they put a name to it after 6 years, I thought, okay, now you know what it is, and fix it. Right? They know what it is, and they should be able to fix it. Didn't happen. And the sad thing is, for most of us, is that we're willing to do just about anything. If someone says, I can fix your pain. Doesn't matter what it takes, we're willing to do it because we want to get rid of the pain. That's our goal, is always get rid of the pain. Doesn't matter how we have to do it, as long as they can fix it and get rid of it. The pain is not the problem. It's the fear of the pain. Never knowing. Remember I said it's up and down and up and down? So on those good days, you think, okay, maybe it's finally gone. But then but it comes back. And you never know when it's going to hit and how hard it's going to hit you. And so your pain is controlled. You are controlled not by your pain. You're controlled by the fear of your pain, never knowing. So that's where all the isolation comes in. You make less and less plans. I mean, you don't want to plan something and then not be able to make it. So you pull back from everything and everyone. And eventually you find yourself very much alone and isolated. Because it's that fear that's the controlling factor. We look to our healthcare providers. They're supposed to know how to help us, right? They went to school. They had all this training. They're really smart people. Problem is, you know how much pain management they had in all of that training? 2 hours. That's it. And that's if they're lucky. It's not in any of the medical schools at this point. They've never been trained. They have never been trained how to help you manage your pain. They don't know. I do a lot of lectures to healthcare professionals, and it's amazing. And they're willing to listen, which is even more amazing, and it's wonderful. So they've never been trained, and they don't really like to work with people with pain because we don't get better. We keep coming back and saying, okay, now what? Now what? So what do they tell you? Learn to live with it. How many have been told to learn to live with it? Right. And you know how it makes you feel? That's it. That's exactly how it makes us feel. Well, great, but how do you do that? How do you live with it? No one told me how to live with it. They just told me I had to, but never how. I think the most important thing for us, more than anything else, is that we want validation. We want someone to believe our pain. We want them to say, I believe you. Because the further down, remember that maze that we were stuck in? And the deeper in we go, the more we need that someone to believe us. And when they don't and they look at us and, we're thinking, okay, maybe they don't believe how much pain I'm in. We become more and more defensive. And most people with pain that I've met are very defensive. I was. I kept telling them how bad my pain was, and they didn't really believe me because the interesting thing about when you go to a healthcare provider, you go to a doctor's appointment, how many of you have ever gone in your pajamas? No one. You know why? Because you try to look as good as you can when you go out. So we're always sending those mixed messages. So we're trying to help them understand how bad our pain is, and yet we've spent 3 hours getting ready so that we look good. We're sending those mixed messages. The longer your pain goes on, the longer it is in control of your life, the more you as a person disappear. And I like to use this picture because it's these two gentlemen walking down that road in the fog. And the further down they go, the harder it is for you to see them. And that's exactly what happens to a person with pain. They lose their identity and they become the horrible chronic pain patient, which I don't like that word. Because you're a person with much more than just your pain. And I will keep reminding you of that. So, when you're told to learn to live with pain, this is what it looks like. Now, I'd be there the rest of my life if I had to solve this. I have no idea what it is. I can't even explain it to you other than it's something scribbled on a chalkboard. And if someone said, okay, before you can leave this room, you've got to solve it, they better bring in a lot of stuff because I'm going to be here for forever. There's no way I can do that. However, if I took a few classes, maybe started with some algebra, plane geometry, got into some trig and calculus, and then maybe differential equations, and if I worked really, really hard, I bet I could solve that problem. But you see, that's how, when they tell you to learn to live with it, that's what it looks like. What we need for them to do is not make it so difficult that we don't understand what they're saying. What we need is 1 + 1 = 2. That's what we need so that we can actually live with our pain. The other one makes no sense, and we don't know how to do that. We do know 1 + 1 = 2. And so what our organization has done is really try to take all the information that you need to take an active role in the recovery process and change it from that very complex formula into a very simple one, 1 + 1 = 2. So when you're told to learn to live with it, the first thing that you need is validated. You need to know that, okay, my pain is real. Okay, you need someone else to believe that your pain is real. It's not who you are, but it is a piece of you. It's a part of who you are. And it's going to present you with challenges. And you need to know that there's hope. And I think that's the one thing this organization is trying to give to all of you. There is hope. It is possible to live a life in spite of your pain. And that is so important for you to remember. Don't ever lose hope. The problem with pain, for so many of us, and I hear this over and over and over again, is all the things people can't do. I can't do this anymore, and I can't do that anymore, and I can't do that, and I used to be able to do this, and now it takes me 5 times as long. There's nothing that I can do anymore that I like to do. And we're so focused on what we can't do that we forget to maybe look at what we can still do. What are our abilities? We always look at what we can't do anymore. We're the glass is half empty, we're not the glass is half full. But it is half full. It's always half full. There's always hope. We just have to look at it in a different way and start to think about what our abilities are. You have to become part of the treatment team, and that's the difference with chronic pain. Because the typical medical model, people go to the hospital, they take care of you. They pamper you, they bring you your meals. They do everything for you. You're a very passive role, right? When you have chronic pain, you can't be passive because you're not in the hospital. People aren't going to take care of you. People actually get tired of you being sick, and that's all they ever hear is about your pain. You have to become, instead of that passive patient, you now have to become an active participant in your care. You really have to accept some of that responsibility. The way to explain how you are part of that team, of your medical team, is your primary care is your coach. Okay? Everybody needs that coach. They're the ones that really coordinate everything for you. But guess who you are? You're the quarterback. You are the quarterback. You're the one where the coach tells you what you need to do, and then you go out on the field and you talk to all of your teammates, whoever they are, whether it's your physical therapist, if it's your counselor, whoever it is. And you tell them, okay, this is what we need to do. And you're an active part of that. If the quarterback just stood out in the field, I'm afraid he'd get clobbered. And so you need to be that active participant. You really need to be an equal part of that treatment team. Without you, nothing's going to happen. So you have to be a part of the team. And what the goal of pain management is, and so many of us think, I just want to get rid of the pain, right? You know what the goal of pain management is? It's to improve the quality of your life, increase your function, and reduce your sense of suffering. Nowhere in there do we say get rid of the pain, because that may be impossible. That's not necessarily mean, oh, you're going to suffer the rest of your life, because we're going to help you understand how to reduce your sense of suffering. Remember I talked about, when you try to think about the best way to describe it, the more you think about your pain, the more you suffer. So redirecting your attention onto other things you have more control over is key in reducing your sense of suffering. And we'll talk about how to do that later. And it's to increase your function and your quality of life. Everybody wants quality of life. So that's really what we're trying to do here. When everything has been said and done, and I lived in Pittsburgh, which is a huge medical mecca. I mean, they have some of the best of the best. The first transplants were done there. And they still couldn't help me. And when I saw the best of the best, the bottom line was there still may be some level of pain. That doesn't mean it's necessarily bad news. So the goal is never to get rid of the pain 100%. There may always be some level of pain. It's how you deal with it. That's what matters. You can still have a full life in spite of pain. You can. I mean, I've been doing this for 31 years now. I absolutely love it because I get to talk to people and hopefully give them a little bit of hope. That's my job, is to just give you that little, all you need is a spark, just one little spark. If you get a spark today, then we've done a good job.